Smoking marijuana is legal in many states, but a new study finds that smoking marijuana may be just as harmful to your lungs as smoking cigarettes.
Eyewitness News reporter Rob Hayes spoke to an expert who says one factor may be that pot smokers inhale deeper and hold the smoke in their lungs longer.
When marijuana was first approved for recreational use in California, weed proponents
I can roll a joint a minute.
were at an all-time high. Pun very much intended. These days, the Centers for Disease Control and Prevention say about 20% of all Americans have tried pot. It's also the most commonly used drug in America and is still illegal at the federal level. But as recreational pot has gained traction in states all across the country, more research has been focusing on its health effects. And one argument marijuana supporters have stood by for years, that weed is healthier than cigarettes, is now coming under fire.
Perhaps it's time to just pause and think about what you're doing to yourself until we get more information.
Dr. Scott Brandman is referring to a new study just published by the Radiological Society of North America. It reviewed lung scans of smokers and finds that rates of emphysema, airway inflammation, and enlarged breast tissue were higher in pot smokers than tobacco smokers.
Marijuana smoke not only damages the airways in the lungs, but it's actually making holes in it.
Emphysema is already the third leading cause of death in the U.S. Brandman says one factor that may affect weed smokers is how they inhale deeper, holding the smoke in their lungs longer. And researchers are also looking at something within pot.
There's a carcinogen or a chemical that we haven't yet identified in marijuana smoke that we're theorizing is damaging the lung and creating these holes.
If you're using marijuana for medical reasons, Brandman suggests talking to your doctor about edibles or ways other than smoking to use marijuana. Everyone else, well, it may be high time to clear the air. Rob Hayes, ABC7 Eyewitness News.